reactive arthritis is not an infection. It's a post-infectious autoimmune disorder. That's why it is called reactive, because it is occurring as a reaction of immunological system in the body due to some infection. But this is not directly an infection. It's basically a post-infectious autoimmune disorder which follows certain infections like chlamydia infection in the genitourinary tract, or ureaplasma urealyticum, or certain gastrointestinal tract diseases like salmonellosis, shigellosis. But these are not actually infection. These are the complication or sequelae of infection which is triggered by those infection, kind of like rheumatic fever, which is not a infection due to group A streptococcus, but follows the infection as a sequelae of that infection. So remember, this is not an infection. So if it is not an infection, then what is this? This is basically, the reactive arthritis is basically comes under a group of diseases which is known as seronegative spondyloarthropathy. Seronegative spondyloarthropathy. Why? What is the meaning of this term? And who comes under this? There are 4 diseases which comes under this, which call, remembered by an acronym PAIR. P for psoriatic arthritis, A for ankylosing spondylitis, I for inflammatory bowel disease associated arthritis, and R for reactive arthritis, PAIR, these 4 diseases. And these 4 diseases, they comes under the seronegative spondyloarthropathy, because these diseases, they are, if you do the blood test, actually, they will be negative for rheumatoid factor, RF factor, which is typically positive in rheumatoid arthritis. So that's why they're called seronegative. Seronegative for RF, rheumatoid factor. And they cause this spondyloarthropathy because these disorders are typically associated with inflammation of the spondyloarthritis. That means they causes inflammation of the spine, including the sacroiliac joints commonly. So this is the idea of reactive arthritis, which is a post-infectious autoimmune disorder occurring due to an reactionary measure against those infections. As a reaction to those infections, it comes under seronegative spondyloarthropathies. And lastly, this disease was previously also called Reiter Syndrome or Reiter disease, but nowadays this term is not used because Dr. Reiter was a German physician who was involved in some unethical medical practices during the World War II in the concentration camp associated with Nazis or Hitler. So due to his involvement in those unethical practices in the concentration camps, his name is not used anymore for this syndrome. We prefer the term reactive arthritis. So the last thing, in a nutshell, reactive arthritis is nothing but post-infectious autoimmune disorder associated with HLA-B27, and it comes under a group of disease called seronegative spondyloarthropathy, which has 4 important diseases. This one is one of them. Other 3 are ankylosing spondylitis, inflammatory bowel disease associated arthritis, that means Crohn's disease and ulcerative colitis associated arthritis. Another one is psoriatic arthritis. Thank you so much.